Good evening, and welcome to CancerCare Manitoba's third Patient and Family Conference. My name is Patty Bocangel, and I'm the Acting Director of Community Oncology Program and Patient Experience. Thank you for joining. As of this morning, we've had 456 people registered to this virtual conference, and it's great to see how the number of people joining the event is going up as we speak. I want to take a moment to thank the CancerCare Manitoba Foundation for their financial support to this conference. Your contribution is vital to our ability to offer this conference. I would now I would now like to do a land acknowledgement. CancerCare Manitoba provides health services across Manitoba on the traditional land of the Anishinaabeg, Ininiwak, Inishininewak, Dakota Oyate, and Dene peoples. We acknowledge that Manitoba is also located on the homeland of the Red River Métis, and northern Manitoba includes lands that were and are the ancestral lands of the Inuit. CancerCare Manitoba acknowledges that colonial practices and policies have impacted the health and well being of generations of First Nations, Metis, and Inuit who continue to experience inequities and obstacles in accessing healthcare, including cancer services along the cancer continuum. At CancerCare Manitoba, we respect the spirit and intent of the treaties and treaty making and remain committed to working in partnership with First Nations, Métis, and Inuit peoples in the spirit of trust, reconciliation, and collaboration while also improving cancer control and outcomes for Manitobans. When doing the land acknowledgement, it is important to reflect on what it means to us. As I reflect on this being the land of the original peoples of what we now call Canada, I acknowledge that I am a guest on this land and that I'm deeply thankful for the opportunity to live here with my family. I believe in the importance of learning that Indigenous peoples are not a homogeneous group and that each community is unique. I also recognize the importance of working with Indigenous partners in meaningful and respectful ways, and do so working with them as true partners in relationships based on trust, where we co develop plans together, supporting people specific and self determined care as we work together at enhancing cancer control and patient experience in First Nations, Métis, and Inuit peoples. And now it is my pleasure to introduce Elder and Knowledge Keeper Isabelle. She will bring an opening prayer to begin this conference in a good way. Elder Isabelle is from Tataskewak Split Lake Cree Nation. She is fluent in Cree language and a certified Cree interpreter. She has attended Red River Community College and University of Manitoba, securing a degree in Bachelor of Arts and Nursing. Elder Isabelle has gone on a healing journey and retraced her footsteps into the past intergenerational effects of residential schools. Her healing ways were taught from elders, traditional people, counselors, family, and friends. Isabelle is also a traditional dancer in powwow and a pipe and drum carrier. Let's hear from Elder Isabelle.
Entonces, Isabel Morse tisnigasan naskumun utasipedotean. Kiwet nakapamas mutwapas paskamistas muchkesunina. Hi, I'm Isabel Morse, Elder Knowledge Keeper, Thompson General Hospital, Indigenous Health Services, um, Bear Clan, Northern Dancing White Buffalo Elder Lady. I will pray in Cree And then I'll say the Lord's Prayer in honor for those that still follow the other religions. Thank you. Kasaman tu mamay tayo mo. Kiwet na kapamis mo tuwas piskamas tuchi kaya sunina. Kasaman tu mamay tayo mo. Sawene me kanwene me kakinaw kuni sinuwa kininuwak. Ay si ayamechek. Asigis kinaw mga chika kinaw yung sinuwa kininuwak. Kasi minoya chikuma agus wena siya chik. Kanwene me sawene me kakinaw utatus kewak. Amen. Egosi.
Thank you, Elder and Knowledge Keeper Isabel, for sharing these words with us tonight and for helping us begin this conference in a good way. Now I'm pleased to introduce Dr. Shri Navaratnam. She's the President and CEO of CancerCare Manitoba to bring greetings from our organization.
Thank you, Patty. And thank you for bringing those prayers, the elder. Thank you. So good evening, everyone, and welcome on behalf of all of us at CancerCare Manitoba, the physicians, nurses, everyone who cares for you, on behalf of all of us. We welcome you to this evening and for the event tomorrow. As Patty Bocangel said at the introduction, this is our third patient and family conference. When we started this, what's the goal? One is we are, as CancerCare Manitoba, we have committed to patient and family-centric care. And so when we do, we say we don't do for you, we do with you. So we engage with patient and family advisors, and with them we created these sessions. So we wanted to do it with you as patients and family. And the second thing I wanted to bring it up is that in a care, whatever we do as a providing healthcare, the most important partner of that relationship is the patients or the people who are receiving the care. So the way we educate the physicians, nurses, and all healthcare providers, it is also important to provide that level of education whenever possible to the patient partners. Because when you are making a decision of a treatment, that you are the most important partner of that conversation. So those are some of those thoughts behind why we need a conference, not just for the healthcare providers, which we do annually, but as part of that annual conference, we wanted to do a conference for patients and families so that you are more empowered of what's happening in cancer, what's happening in this space, and what helps. Like today, you're going to hear from the keynote speaker about exercise. So that's the purpose of this conference. This is the third year, and I'm so pleased to hear that every year the number has grown. And today, if I've seen the latest number, it was around closer to 500 people have registered, and we encourage more to register as well. And when it comes to as you as the partner, the more information you have, the more you are empowered and to make those decisions. And more importantly, then the most anxiety-provoking thing for anyone is not knowing what's happening to me. So that's the most important thing and a difficult thing for everyone. And last week it was kind of a difficult week for me because I visited UK to visit my sister-in-law who's been recently diagnosed with breast cancer. I spent quite a lot of time, but again, it reinforced the fact that the more she knows, the less anxious she is. So that is the goal of CancerCare Manitoba. We wanted to provide the general information about cancer as a part of the conference, but also we are committed every day that you get the right information. So this conference, then what you're learning today is one as a conference, like a professional conferences, but what I wanted to leave it with you is please ask questions whenever you see any healthcare providers. We have a resource center, and you're going to hear from Patty later on about our Hope and Healing program, because we wanted the day you diagnose with cancer, the hope and the healing should start that day. So for that, information is very important. I always say knowledge and information is the biggest power any one of us could have. So thank you all for joining. Thank you for Patty and the team to putting together this conference. And thank you for the keynote speaker. Thank you for joining us from Calgary. Thank you. And please, today, that as I said earlier, I wanted you to enjoy this evening and tomorrow, but go with the commitment that we are there for you to give you more information, whatever information you need and whenever you need. So thank you again. Have a wonderful evening. It is not easy. And I always say the diagnosis of cancer brings the most profound emotional and physical reaction. So it's not easy. In spite of all that, I'm very proud of all of you that you have joined the conference. So thank you for joining, and looking forward to having more of this on behalf of CancerCare. Thank you.
Thank you, Dr. Navaratnam. And yeah, what a nice way to continue after you, knowing that you've spoken to the importance of patient information as a way to empower patients to make informed decisions. We are going to get into that as I start my presentation. So now I'm going to share my screen. It's just taking a little while. And there it is. So I am very excited to share with you how CancerCare Manitoba is enhancing patient experience and outcomes through the Hope and Healing program. One of our main priorities in the roadmap to cancer control for our province is Priority 4, which is to improve the patient experience throughout the cancer journey. And two important objectives in this priority has to do with our goal of providing more emotional support to patients, as well as to improve patient access to information. As Dr. Ratnam said, anxiety is very much linked to not knowing what to expect, to feeling that you don't have enough information. So we are aware of this, and we are making efforts to have this enhanced for you. One way that CancerCare Manitoba is enhancing the patient experience is through the expansion of our current patient and family support services program into the Hope and Healing program. Based on the solid foundation of the patient and family support services, which is a program that you may be familiar with already, we are expanding it so that this new Hope and Healing program is going to focus on person-centered care, and its mandate is to offer cancer support services, um, but provincially, having these services integrated to clinical care. And by cancer support services, I mean those services that are related to the patient's needs that go beyond primary treatment as radiation, surgery, or systemic therapy. So we are talking about things like counseling or seeing a dietitian to help with nutrition needs, or accessing specific patient information that can help the patient and families understand their current situation. So as I said, this program is provincial and will be integrating cancer support services into the overall care of the patients, supporting patients to access holistic and really person-centered care. This program will serve patients with all types of cancers and will offer services in keeping with health equity, This is the concept of each person having different and unique needs and needing those needs to be met in different ways to make sure that they can reach their full potential and be at their best. To increase access to all Manitobans and also patients in the Kivalliq region of Nunavut, these services are going to be offered in person but also virtually. And in person services are going to be offered at physical spaces that we are calling Centers for Hope. So once we had this idea of or vision of what we wanted to accomplish, like Dr. Navaratnam said, having the patient voice for health planning is important. It's been shown that it helps the healthcare system plan stronger programs and it helps with outcomes and patient experience. So that's what we did. We consulted with patient and family advisors, patients and caregivers, our CancerCare Manitoba providers, as well as leadership, literature on patient experience, and we also looked at what other cancer agencies were doing. And through this engagement, we heard that patients and providers were saying, yes, we really need to focus on programs and services dedicated to aspects of cancer that go beyond the cancer itself. So, again, this concept of holistic and person centered care. A few examples of the services highlighted by patients and caregivers are the need to access counseling services, access to dietitians that can help with nutritional needs, access to support groups to be able to engage with others that are facing a similar situation, access to services that help strengthen the body, such as physiotherapy, occupational therapy, speech and language pathology. And another very important need that was highlighted was that need for information and education. And this can be offered in a variety of different ways through booklets, pamphlets, handouts, books, videos, but also through having the opportunity to meet with a patient and family educator that can take the time to answer your questions in a paced environment that's conducive to learning and understanding so that you can make informed decisions and be an active participant of your care. So, once we gathered all of this feedback, um, we were able to say, all right, so how will this hope and healing program look like? So, we are going to focus on four specific areas, which are emotional support, information, education, and engagement, physical strengthening, which means things like dietitian, speech and language pathology, occupational therapy, physiotherapy, and uh, the domain of practical needs, which refers to those specific needs, sometimes unexpected, that patients and families face, which, for example, could be the need to connect with resources so that you can access transportation and accommodation to be able to access the treatment that you need when you need it. In terms of the Centers for Hope, we asked our patient advisors and patients what were they expecting in terms of how do you think these Centers for Hope should look like? And the feedback we got is that patients are wanting environments that are non medicalized, spaces that don't look like the clinics or the hospital side of things. They want spaces that are welcoming, that are warm, and that are calm, places where they can forget about the other aspects of their cancer. And the vision that we have for these Centers for Hope is to have a Center for Hope in each region, one in the north, one in the south, one in Prairie Mountain, one in Eastern Lake Eastern, and in Winnipeg as well. So, in terms of what we have at the moment, we have two Centers for Hope in Winnipeg. The Center for Hope at McCharles has been around for longer as part of the Patient and Family Support Services program, but we now have a Center for Hope in the Victoria Hospital site. This started back in February, and patients and families can come here. We have a lending library there. We also have a wig and headwear service, as well as you can come in to talk to our coordinator to hear about the programs and services that are available to you. I am very happy to announce that we will have a new Center for Hope opening in Brandon very soon as part of the Western Manitoba Cancer Center expansion that is happening. And this is what is being called the Paul Albertson Center for Hope, based on a transformational gift from the Paul Albertson Foundation to the CancerCare Manitoba Foundation. This is a real picture of the outside of the center, and this is rendering. The center will have two courtyards for people to enjoy uh, spaces in the summer. It will have a beautiful healing room for group sessions, for art therapy, things like that. And so, what will be available at that center is a lending library. Patients will have computer stations that they can use to look up information, to print some resources. They will have a kitchenette and sitting area to enjoy some coffee or tea as they wait, or if they want to be there for specific reason to read a book or a pamphlet. They will have counseling services there, nutrition services, meaning dietitians. There will be a weekend headwear room, which will be called a studio, where people can try on wigs and take them. They will have occupational therapy, speech and language pathology, and as I said, a healing room that can be used for group sessions and also for hybrid programming where people can join in person but also connect virtually through other centers, like, for example, Winnipeg, if we were broadcasting from Winnipeg, a specific educational session. And also, this is to let you know that we have a new Center for Hope. It's being built, it's under construction right now, and it will be in the Boundary Trails area in the south of the province. So I wanted to highlight the Navigator. This is a patient and family newsletter that we have every month offered, and it basically has a list of all of the support cancer services that are available to you and your families. We had a soft launch of the Hope and Healing program at the end of this summer, and we featured that soft launch in our Navigator issue of October. You can find the navigator in our website and you can get it electronically. But if you would like to receive the navigator newsletter by mail, you can call 204 787 2970, or you can email this email address that we have here. If someone could please put it on the chat for patients to have that handy, that will be really appreciated. So again, we offer a variety of programs and services regarding support cancer services, and these services are going to continue, excuse me, to continue to expand as time goes by. So if you want to learn more about the cancer support services and programs offered by CancerCare Manitoba, uh, Hope and Healing program, please visit the virtual booths. You will be able to learn more about those services there and also ask your healthcare team. I want to emphasize what Dr. Ratnam said. We encourage you to ask questions. That is your right. So when you are in your appointments with your healthcare team, ask any questions you may have, including if you want to learn more about how to access the services provided through the Hope and Healing program. Thank you very much. And now I will be introducing our next speaker. All right, so I'm excited to introduce Dr. Nicole-Culos Reed. She is going to be our keynote for the night. She is a professor of health and exercise psychology in the Faculty of Kinesiology. She's an adjunct professor in the Department of Oncology in the Cummings School of Medicine and director of the Health and Wellness Lab and Thrive Center. As a health behavior change researcher, Dr. Culos-Reed is passionate about building capacity with the fitness industry to safely and effectively support individuals with cancer to live well and move more. I would like to welcome Dr. Nicole-Culos-Reed and hand things over to her.
Perfect. Thank you, Patricia. Before I start, I'm just going to get my slides open. Alrighty, I'm hoping everyone can see the slides. First off, thank you very much to CancerCare Manitoba and the Patient and Family Conference organizers for inviting me to be here with you this evening. This is one of the favorite parts of what I get to do, and that's sharing the evidence and the resources around the role for exercise for all individuals living with and beyond cancer. And I think this quote kind of captures it, and we often hear this from people, this idea that, well, it's just exercise. People can find it in their communities. Everybody can just do it. And if that were the truth, we'd likely all be doing a whole lot more of it, given all of the benefits we know that exercise can bring. So I'm excited to share with you this evening the value of exercise, the evidence for it, and really how can you think about moving more, getting more physical activity, or getting more exercise. Just a note that I know I can't see anybody, so if anything happens to the slides or it's not going along or you can't hear me, please somebody just speak up and let me know. Let's see. Alrighty, we already had a lovely land acknowledgement and a beautiful message from Elder Patricia or Elder Isabelle. And I just want to acknowledge that I'm in Calgary joining you here this evening, and that no matter where we are tonight, we live and work within the traditional territories of First Nations peoples across Canada. Here in Calgary, that includes Treaty 7 region, the Indigenous nations of the Siksika, the Blackfoot, the Kainai and Tsuut'ina, and the Stoney and Nakota nations. I also want to acknowledge that a large part of our work is really focused on and championing equity, diversity, inclusivity, and accessibility, not just within the team that we've built, but in the research that we're conducting and all of the resources that we're developing across our training and program implementation. And I'm going to highlight a few of those this evening. Finally, before I get started on the content, I want to recognize that I'm the co-founder of Thrive Health Services, and you will see some of those resources presented tonight. I also, I think most importantly, want to put forward my bias, and that's that I truly do believe that exercise is a very beneficial part of the cancer care journey and must start to be prescribed just like we prescribe and tailor treatment regimens for individuals. And so, you know, this picture is a little bit funny, exercise as a pill, but there's been a lot written about if exercise was a pill, it would be the most prescribed pill in the world because of the enormous benefits that come physically, mentally, emotionally, and socially from engaging in some level of exercise or movement on a daily basis. And so with that set up, I'm going to start off this evening talking about the evidence. And you might be aware or you might not. It might be a pleasant surprise to see that there's a lot of good science behind the whys of exercise and the benefits of exercise. And then really, I'm going to focus most of the next hour plus that I have with you talking about and looking at how can you make movement work for you and what does that look like for you? Because maybe this is the biggest take-home message, but it's not one size fits all. And you will see some messaging around one size fits all, around our guidelines, some of the resources. But it's really just like any prescription, any pill, we're giving it to people based on what they need and what their bodies are at. And the same goes for exercise. So just keep that in mind as we go through this and think about, okay, if this is going to be for you, what does it need to look like to work for you? So let's start off with the evidence. And there's lots. I'm talking tens of thousands of studies that have looked at the value of exercise for individuals living with and beyond cancer. On the screen here, you can see just 4 screenshots of some of the larger systematic reviews. And these are ones that have primarily looked at not only managing symptoms and side effects associated with treatments, but also the long-term benefits that I'll go into in terms of survival outcomes. And there's tens of thousands of studies, and really our highest level of evidence comes from studies called randomized controlled trials. We have more than 2,500 randomized controlled trials looking at exercise across different treatment tumor types, treatments, and into survivorship, so across different phases. So a lot of really strong evidence, and across all of these trials, really consistently seeing the value of physical activity, the benefits of exercise. So if we take a kind of 10,000-foot view of this evidence, it's really clear that exercise is both safe and beneficial at any stage of the cancer experience. So we've got exercise pre-treatment. So this is called exercise prehabilitation. And this is probably one of our fastest growing areas right now, is looking at how can we use exercise once somebody's diagnosed, but before treatments begin, to improve their well-being, to help them manage, right? A lot of the things that we hear and that I've seen, like many of you impacted throughout my family with cancer. And there's that period of waiting that can be very distressful. The term and being told you have cancer can take away a lot of the sense of control. And so this opportunity to have people engage in something with a focus on their wellness and focus in getting ready to be able to tolerate treatment better can be a very powerful role that exercise can play. Then we move into the evidence that's really looking at the role of exercise during treatment and into immediate post-treatment phases. And this evidence is also quite clear, showing the benefits. And I've got a couple slides coming up where we'll dive a little bit more into that. And then there's the role for exercise long-term to help manage late and long-term side effects, to also help individuals who are going to be living with cancer, whether it's advanced cancer or into palliative stages of cancer. So there's a lot of evidence across these different areas, and I think it's both ends, the prehabilitation and the how do we work with individuals living with more advanced cancers who, due to treatments, have a longer timeline there and want to enhance their quality of life. So both of those areas, we're seeing that growing impact of the research being done. Now, across the literature, there's literally thousands of different outcomes that have been studied. I've grouped them here into some of what we're seeing most common in kind of bigger categories. And then the next couple slides, I'll break down just a couple of these. But across the board, we see all of these different benefits. And it's often really right here in the middle that people think of about exercise, right? To improve physical functioning, to improve your fitness, whether that's your strength, your balance, your heart and lungs, your cardiovascular fitness, or your flexibility, right? So we know we can give exercise to anyone along that continuum, pre, during, post-treatment, and see some of these fitness changes. Now, the impact of it might change depending if you're on treatment and have a bunch of negative side effects. But typically what we're seeing is we can improve some of these different indices of fitness depending on what the actual intervention is. We also see that often we're using exercise, especially during an immediate post-treatment, to manage treatment-related side effects. And the biggest one studied, one of our biggest outcomes across all of the trials, is looking at the role for exercise for cancer-related fatigue. So one of our most distressing side effects can really negatively impact quality of life. And we know that many individuals experience this cancer-related fatigue, and yet there isn't a single pill. There's not a treatment that is regularly prescribed. So there's a huge potential role for exercise in managing, reducing cancer-related fatigue. And then we have some of the more psychosocial pieces, enhancing well-being and overall mood, and decreasing the indices of emotional distress, depression, stress, and anxiety. So a lot of evidence maybe outside of what people typically think of what exercise can do, right? Exercise for the physical body. So much evidence really showing that with the management of immediate effects, addressing late or long-term effects, improving emotional mental well-being, symptom management, and overall mental health, is that what we see is that individuals who report being physically active report a higher quality of life than individuals who are inactive. And again, this is across the board, so a very robust finding. Doesn't matter if we're looking at breast cancer, lung cancer, colorectal, mixed groups, ages, genders, all of those pieces, and doesn't matter on the type of physical activity. Engaging in it regularly results in this self-report of a better quality of life. So pretty compelling evidence when we look at all of that together for just some of the large categories that we know exercise can impact. Now, there was work done a couple years ago to really start to pull some of the evidence together to build towards some guidelines for exercise. And this is a table that we've adapted from that research and the reviews that were done. And so as you can see, some of those pieces that I've just mentioned, right? The anxiety, depression, fatigue, cancer-related fatigue, quality of life, physical function indices, and another one here, one of the symptoms, side effects of lymphedema. So across the exercise trials, we have a strong level of evidence. That essentially means that it's been studied a lot. There's lots of studies have measured these outcomes, and very consistently across the board, we're seeing improvements in these outcomes, regardless, again, of the type of exercise, the duration of exercise, or the population that was in the study. Then we have moderate levels of evidence for bone health and sleep benefits from exercise. And again, this is a function of the amount of research that has been done to date, as well as then maybe a bit more flexibility or a range, I guess, in terms of the outcomes, right? So some studies may be dependent on the type of measure for sleep, as an example, see more or less of a benefit. So when we see this moderate level, it means looks like there's some good things happening, but we need more research. And then you can see a number of outcomes that are deemed, relatively important. We're measuring them, but we don't have a ton of evidence yet. So things like cognitive function, you'll often see different interventions to help with brain fog, cardiotoxic effects of treatment, preventing falls, addressing nausea and pain, chemotherapy-induced peripheral neuropathy, and then a whole host of just other symptoms, mental, physical, and functional. Important to recognize that because they're in this inconclusive category doesn't mean that you might not see benefits on some of these pieces. It just means, for the most part, we haven't studied enough of these as outcomes, right? So it's hard in an exercise trial to measure everything. And so typically teams will pick, this is what we're measuring. And often that's been number one, quality of life, and number two, cancer-related fatigue. Those are our biggest, most robust findings and well-studied outcomes. So there's really a need for research in exercise oncology to start to dig into more of these outcomes and look at them across populations and across that treatment timeline to see where does exercise potentially play a role. Okay, and these summaries really here of this evidence don't also get into maybe some of the nuances of the exercise prescription itself, which might play an important role in whether or not we see benefits. So let's dive just a little deeper into this idea of cancer-related fatigue and exercise. It might actually seem counterintuitive. For most of us, when we are tired at the end of the day, we want to sit and rest, right? And then we sit and rest, and hopefully that rejuvenates us so that we've got the energy and we're not tired the next day. Or you get to sleep earlier, or whatever it might be that you do to deal with the fatigue. However, for cancer-related fatigue, what we know is happening is this downward negative spiral. So somebody is experiencing cancer-related fatigue, they have to stop and rest. They're really stopped in their path. That results in actual physiological deconditioning and a loss of muscle mass. So we get this muscle atrophy or this cachexia. That contributes to the experience of more fatigue, which makes the person stop, rest, or not be able to engage in activities of daily living. And you get that further negative downward spiral, which we call this vicious cycle of fatigue. Now, unfortunately, this is very prevalent. Some of the reports have seen upwards of 94% of individuals reporting cancer-related fatigue, and clinical healthcare provider teams indicating that they're seeing this reported. Yet only 5% of clinical teams, healthcare providers, report treating it. Okay, so there's this gap between the impact of cancer-related fatigue on the patients, on the person in your system, and the response, really. And that's because fatigue is multidimensional. We don't know often why it's being caused. Often, if the physiological reasons are ruled out, there's not a simple answer. There's not uphill. There's not one modality to help people address the fatigue. However, there is exercise, and there are a number of very strong studies done showing this link between exercise and management of cancer-related fatigue. And across this, we see that there's cardiovascular interventions, resistance type trainings, and combined exercise, all contributing to reduced fatigue. So a couple of years ago, I was able to be part of this team led by Dr. Lillian Sung out of Sick Kids Hospital in Ontario, in Toronto, and where we looked at all of the physical activity evidence, but just the RCTs. So remember, that's our highest level of evidence, the randomized control trials. And we are able to pull out 123 randomized control trials that had looked at fatigue in patients with cancer or the stem cell transplant patients. And we were able to systematically review and conduct a meta-analysis of all of that evidence. And what we found was across the board, physical activity reduced fatigue severity. So it is a very beneficial tool to address this cancer-related fatigue. And that impact of physical activity on fatigue didn't differ based on the patient. So what their diagnosis was, the stage, their age or gender, or any other factor. And it didn't differ depending on the type of physical activity. So this tells us, this is a really robust finding, that providing exercise as a tool within treatment plans, so something that you're offered from your cancer care system, can be one of the very most evidence-based tools that we can provide for managing cancer-related fatigue. Now, it doesn't mean that exercise alone is going to be the answer for every single person. As I mentioned, fatigue is multidimensional. And so being able to offer exercise as a tool with some of the other fatigue management, whether it's cognitive behavioral training, mindfulness, breath work, and or pharmacological medications to help manage the fatigue, may be kind of some of our best offerings. But it's important that we recognize that, again, it's not just exercise. Exercise is a tool that is evidence-based, that is being shown and is shown to be one of the very best tools we have for managing cancer-related fatigue. Okay, so that's one of the big symptom management pieces that we're continually studying and finding that it is exercise and it plays a significant role. Beyond the management of symptoms and improving quality of life kind of right here and now, the other big area of research is really this focus on survival benefits, right? And so this is population health studies looking at tracking individuals over time and looking at the association between long-term outcomes. So in the case of individuals with cancer, looking at recurrence, morbidity, and mortality. So mortality from cancer, but mortality also from all cause. Okay, so this is large population health study tracking over time, looking at association. So it's not cause and effect, it's not an intervention. But what this research really clearly shows is that across the board, and so we've looked at different types of cancer, breast, prostate, lung, colorectal, ovarian, that a modest amount of moderate to vigorous activity. So really at hitting about 90 minutes of moderate activity a week to upwards of 3+ hours. And before I highlight these findings, moderate activity is like you're late for an appointment. So you know that feeling when you're parking and you're walking as fast as you can to get into a building because you're late for the appointment? That would be equivalent to a moderate level of activity. Vigorous would be like you're going for a jog or a run, right? So you're really breathing heavy and your heart rate's starting to pound. Okay, but that level of activity, so think a moderate brisk walk at 90 minutes a week. So 3 30-minute walks a week, or less number, higher minute, higher minutes. That is actually associated with a reduced risk of cancer recurrence, reduced risk of cancer mortality, and reduced risk of all-cause mortality. And your comparison here is people who report being inactive. Okay, people who report not getting any physical activity minutes, which you might think, well, who's actually reporting not getting any minutes? And unfortunately, the answer is a lot of people. And so based on these guidelines, or based on this evidence, based on survival outcomes, a number of groups have come together and collated the evidence to present exercise guidelines and recommendations so that we can start to move people from not doing anything at all, which is upwards of 70 to 80% of individuals with cancer, to starting to do some movement, to building up an exercise habit. So the big ones that we typically follow in Canada are these ACSM, the American College of Sports Medicine Guidelines. But there's ones from Australia, there's others with nutrition and physical activity from the States, there's ones in the UK. So there's a lot of work that's been done by different groups, and it's all very consistent and all showing really similar guideline recommendations. And so these are the kind of three big take-home messages across the guidelines. The first is exercise is safe and feasible during treatment. So I've been here in Calgary since 2001. And, when I first started doing this work, a lot of the clinical team members that I was attempting to connect with were hesitant, right? They were like, well, everybody's pretty sick. Maybe you need to just wait. And so we had a hard time getting people during treatment. And a lot of the work was in that post-treatment and longer-term survivorship phases. As our knowledge has progressed, we're seeing more and more the benefits of starting individuals, and again, tailoring, you're going to hear me start to say this word a lot, tailoring what we can offer to them to help them to move during treatment, to manage those immediate effects, and again, to exert a bit of control over what can often feel like everything's out of their control. Okay, so that evidence I was showing you really clearly supports that we can help to maintain, if not improve, physical functioning, fatigue, and quality of life during treatment. So the guidelines are to avoid inactivity and return to normal daily activities as soon as possible following diagnosis and during treatment. The guidelines and the evidence support that after treatment, exercise is not a nice thing, not something we hope you do, but it's essential for recovery and fitness. So we can improve physical side effects. And we've got, again, you saw that list, some strong evidence, some moderate, and some still growing. But we know we're going to enhance overall well-being and quality of life by having you engage in regular physical activity or exercise. It's this last point that I think is the most important. You're going to see the guidelines next and our standard numbers of where we'd love everybody to be. But really, it's this idea that we can't just give you a one-size-fits-all. We can't tell you all to go and get X number of minutes a week. We have to start with where you're at and support you to start there and to build up slowly over time to get to whatever works for your lifestyle. So individualization and tailoring are absolutely essential for us to optimize with you the benefits of physical activity. Trust me, if you've been very inactive and you try to jump right to the guidelines numbers you're going to see next, probably not going to feel good, and you're probably not going to want to keep on going, right? And so we're really trying to take these guidelines and then look at each individual and go, okay, what works for this person? The actual guidelines are here. And if you've got a physical activity background or a fitness background, you might look at these and go, yeah, this is great. I understand it. I understand, though, for many individuals, you look at this and you're like, wow, I'm not sure what all these numbers and percentages and acronyms even mean. But this is literally what, if there's anything that is standard of care in CancerCare anywhere in Canada, it would likely be a brochure with this information on it, right? So there's not many places across Canada that we've got exercise fully embedded into CancerCare other than an educational resource. Okay, so these guidelines are great. These are based on, here's our level of evidence. Here's where we know that you're going to optimize many of those outcomes, the physical ones, the functional ones, the mental and emotional well-being ones. Okay, those come with hitting that 90 minutes of moderate intensity aerobic exercise per week, 2 days of strength training, and flexibility training most days of the week. I would suggest balance is also an important piece to add into there. It's not officially in the guidelines, but it is kind of built into both strength and flexibility. Okay, so again, 90 minutes of moderate intensity, that's your brisk walk, 3 30-minute sessions a week. Strength training is working your major muscle groups, right? So I don't know where you're joining from today, if you're at home, still at work, sitting down, but I'd encourage you throughout the talk and throughout all the sessions you go to is just think about, well, even if you're sitting, can you, I don't know, bring your legs out in front of you and extend them back and forth? Or I'm at a stand-up desk, you can go up and down a little bit. Or you can maybe just take your arms out to the side and do some curling action, bicep curls, right? Strength training doesn't have to be going to the gym and hitting big weights. It doesn't even have to have any weights. You can use your own body resistance or those Dynabands, the stretchy bands you might have gotten if you've been ever to physio, right? But it's about working your major muscle groups. And we're going to come back to this when I share with you some of the resources we've built and ones that are available to you in terms of thinking about what do these types of exercise need to look like. And then the flexibility training, and that's, most days of the week, i.e. every day. And you know what, maybe we'll just take 2 seconds here to show you how easily this is to do. I've been a fitness instructor for years and an athlete before I started teaching fitness. And I will say in my fitness classes, this is always the one piece that people used to always be like, yeah, I'm too busy. I've done my workout and now I'm back to work, right? But you can scan your body from the top of the head to the tip of the toe at any point during your day and just see where you're holding tension. For most of us, if you're going through that cancer journey, depending on where you are, but think about like during treatment times, you might be driving in snowy winter weather. You might be gripping the steering wheel. You might be sitting in a waiting room for long periods of time. And typically, most of us, we're not like, fully posture aware and sitting up nice and tall and shoulders open. So we tend to slouch. We tend to round out. We tend to carry tension in our neck and shoulders. And so if you feel like you're going, yeah, that might be me at some point in time, a couple quick exercises to do is think about taking the tip of your nose and just looking down, right? And feel that stretch over the back of your neck. Okay, same thing as you can take your ear to one side and then over to the other. So you can do this while you're listening to talks, while you're in a waiting room. Maybe if you're the passenger in the car, not the driver, right? But you can do these movements, and it's that old idea, way back when used to be you'd have somebody sitting and a child in a classroom and don't fidget, don't move. We want you to fidget and move, okay, wherever that looks like. So whenever you can roll your shoulders. Or a big one for many of us when we're tired and our posture's going is just opening up through your chest, right? So if you can open up through your chest, all of a sudden you're moving the musculature around your lungs to let your lungs take a fuller, deeper breath. Okay, on a day when you are tired, if you take nothing else from the talk today, think about opening through the chest and being able to take a fuller, deeper breath. As soon as you do that, you are actually energizing your body because that fuller, deeper breath is oxygenation coming in, getting into your bloodstream, and then that moves out to your muscles. Okay, so our energy for movement, our energy to engage in activities of daily living comes from our breath, not so much from our food and our water. We can go quite a while without those. Can't go very long without a good deep breath. Okay, so if there's nothing else you remember from tonight, it's open through the chest, shrug your shoulders out, and take a fuller, deeper breath. That can be part of your movement plan. Okay, so we've got evidence, we've got guidelines, we've got educational brochures, and yet we still very much have an epidemic of inactive behavior. And I love this picture. You might think it's like, who would walk their dog out of their car? Well, I have an 8-month-old lab. I have to walk every day. And I see people at the dog park all the time that let their dog into the dog park and they go sit in their car. And I get it, it's cold. But really, the purpose of having a dog, not only to love a dog, but as you get out and it does make you have to get some movement every day. So, we laugh at this picture, but it's not too far from the truth for how many individuals will avoid activity. And we also have an environment that often isn't supportive of us of getting physical activity. So I have a poll, and I'm not sure if I can pull it up or if it's going to get pulled up for me, but the first poll is about days per week. So let's see if this is going to work here. There we go. So if you can take a second to answer the poll, and we're going to see the results, I think, as they come up, and I can see this right now as well. Oh, we've got the first vote in. Lots of people active. Awesome. And don't worry, wherever you are is okay. I have many days where I plan to be active, and then I'm like, oh dear, where did my day go? No activity. Awesome. Some days, most days, we got a few every days. You should be able to see the poll, I think, on your screen and just click your answer, hit submit. We'll give it a second here, let a few more votes come in. I don't actually know how many are listening and with us tonight, but don't be shy. Put your vote in. There's no judgment. I'll give it just a couple more seconds here. so it looks like I'm actually speaking to the choir here. Many of you are already active. I think if you're doing some days, most days, or every days, you're great. It's when we've got no days, or what are you talking about? What's physical activity really about? That maybe there's some room for improvement. So great job, everyone. I'll give one more second for votes here. And then let's see what happens if I close it. Okay. So thank you for those that have voted. Can see that we've got what I would consider a fairly active population, which is fantastic to see. Hopefully you can see back up to my slide again. That was very smooth. Thank you, Backstage, for helping out. So maybe all of you are looking at this and going, never would I ever. Again, I just want to remind you that, you know, oftentimes what we see across the cancer journey is that inactivity really increases. People feel overwhelmed, they're busy, they're pulled out of usual routines. And so often activity levels go really down, inactivity goes up. And that's because there's often a ton of barriers, right? If it was just exercise and easy to do, we literally would all be doing it because there's not a lot of negative side effects associated with exercising if we do it at levels that are appropriate for our body, right? So if we are building up our exercise, if we're starting at where we're at and adding slowly, one of our mantras is start low, progress slow, we can help people to get through some of the barriers. But there's tons of barriers. There's barriers when you're on treatment and just not feeling well. There's barriers of return to work. There's barriers of other demands in your life, maybe good demands and family and socializing, but it's all a balance of how do you fit in getting that 30 minutes, right? And so tons and tons of barriers that we're going to talk about. Before we get into this, if I can have the second poll up, please, on the confidence. So I'm guessing based on activity levels that our confidence might be pretty good, but let's just take a look at this next poll. So here you go. How confident are you that you can engage in exercise? So you've seen the guidelines levels and what we're talking about. A lot of you are already being physically active. Some of you are on most days, many days. And what we would expect to see is, yeah, with people that are used to being regularly active, one of our biggest predictors is that I know I can do it. I'm confident in doing it. And so I would expect that many of you are going to be in this higher end, which is great to see. Fantastic. Awesome. Just give it a second. So again, if you want to vote, you obviously don't have to, but if you want to think about this, and again, there's zero judgment. We are where we are. And, you know, for most of us, if you've had experience with it and you know you can do it, oftentimes our confidence is there. And so that's not something we need to target. Often what we see of people coming into our programs is that they're coming in and they haven't been regularly physically active, or they have been and now they're going through cancer and it's changed everything. And so they're just not quite sure what's safe, what can I do, what's not going to exacerbate symptoms or side effects, right? And so confidence can really fluctuate, but we know it's a really critical part to helping people really start to develop this idea of getting more exercise and getting the benefits then from regular engagement. Awesome. Thank you for voting. Okay, so we've got barriers. So part of what we need to do is start to address these barriers and help people, because the whole issue is this of exercise non-adherence. So this is the most cited stat in all of exercise psychology, and it's this idea that 50% of people drop out within the first 6 months of starting an exercise program. Okay, so we're coming up to that time of year, but New Year's resolutions, January 1st. The most common New Year's resolution is I'm going to get healthier, whatever that means. And for some people, that's I'm going to start to go to the gym. I'm going to go to the gym every single day. And I can tell you, I work here at the University of Calgary. The gym is right down the hall. It's packed. It's packed in January. It's pretty packed in February. And then it starts dropping off again to get back to the usual levels, right? So this idea of exercise non-adherence is a critical one because all of the benefits of exercise are only achieved by doing it regularly. Okay, so if we set you up, we give you a great program, but we don't help you build your confidence. We don't address barriers. We don't help you build the other skills that you need to be able to do this independently. Once we take away the program or you're done the initial program, there's a good chance you won't keep going, right? And so we have to think beyond getting people started to getting people to continue on and build the skills. And so the framework that we use is the one you see here. It's called a social ecological model. And it's a framework where we expand out from our focus on the individual. So in much of what behavior change is about, whether we're talking diet or smoking cessation, looking at alcohol intake, we typically, and exercise, we typically focus on the individual. We say, okay, here's where you're at, here's what you need to do, we're going to set you up and you have to make the change. Okay, so we put the onus of behavior change on individuals. And ultimately, yes, an individual is going to be the one that makes the change. However, if we start considering these domains of impact around the individual, right? So in terms of physical activity, okay, well, what's right around people to support them? Do they have access to a program? Can they afford a program, right? Is it, within what they can access in their activities of daily living? Where can physical activity be achieved, right? That's building out around the individual. So my example in this one is often just think of, where you live in winter months here in Canada. I'm sure for you in Winnipeg and us here in Calgary, getting outside, slippery sidewalks might not be as easy. And so how do we get over that physical activity domain barrier, the built environment right around you, right? Then we've got, social cultural. A lot of the work that we're doing is looking at visible minorities. And we've started with both South Asian and Black populations and the different cultural norms around physical activity and what's acceptable. And it's, there's intersections with gender and sex and age, socioeconomic status, right? So there's a lot of pieces that can play a role there, but we need to start addressing those if we're really going to expect an individual to make behavior change. We've got to start to look beyond the individual to what do they have access to? What's their norms within their environment? What physical access do they have? And then at a policy level. So a huge part of our work is not only building these resources, but advocating within our healthcare systems to have these fully implemented as standard of care, not as something you're going to find in your community, not as something you're going to walk into a random gym and just see if they can help you, but changing the environment in each of those gyms so that we can very safely and effectively deliver through qualified and trained exercise professionals the right program for you. Okay, so it's a bit bigger picture, and thinking about moving beyond you have to make the change to how do we support, and I will say, how does CancerCare support you to make this change? So with that work, myself, along with a number of excellent colleagues across Canada, have put together a couple of papers that are really about building what I like to call the pathway. And big picture is I'd like you to think about this in terms of what's your wellness pathway as you go through what is typically an illness journey with cancer, right? I'd like you to just think about right now or jot down for yourself, well, what wellness opportunities have you had? Right? Where have you been offered the opportunity, given the support for, given access to wellness? And wellness you can define with lots of different pieces, right? But you can start to think about, okay, well, what has been your exercise piece? And so we've thought about this a lot and developed these pathway models. So this was our first publication a few years ago in Current Oncology. And then we were invited to do this more recently, specifically tailoring it for breast cancer care. However, I will say you could take out breast cancer in this diagram here and put prostate cancer or lung cancer or lymphoma or leukemias, like whatever, right? So we did the publication for our breast cancer specific evidence we had, but it could be tailored and it must be tailored to every tumor type. And so you can see here, this starts right from cancer diagnosis and with the healthcare team and some screening to eventually get people down to a triage, screening, and referral to the right resource for them at the right time, whatever that might be in terms of exercise. But for us, the key piece here is having those qualified exercise professionals, clinical exercise physiologists or registered kinesiologists. That's the professional. So that would be able to do that screening and get you to the right exercise resource, right? And so the exercise resource can be anything from education if you're already doing it, and just some additional resources to full-on screening and into supervised programs that are exercise oncology programs. So this model, we think, is really a simple pathway to truly embed exercise as part of supportive cancer care, with it inclusion in these transdisciplinary teams that might have cancer physiatrists, rehab oncology team members, so PTs, OTs, speech, then your psychosocial, your social worker, psychosocial resources, and other types of supportive care resources. Maybe it's pain management and palliative care resources. All of those combine to include the clinical exercise physiologist so that we can bring in the benefits of exercise at whatever level that might look like for every individual, and really get the right resource to the right person at the right time. Now, as we're doing this and starting to build this, our key is we take a very tailored approach. So you're going to see in a second here some of the programs that are even available to you in Winnipeg. And it's really critical that we address some of those barriers that people might be experiencing. And these are just some of the questions that we've got in our Canada-wide program I'm going to tell you about, but that we're tailoring and modifying. So even though they come into a group-based program, we're addressing their needs based on that screening and that pathway to make sure that they're getting into the right programs and being given the right resources and the right information, and addressing some of those barriers right off the bat, and the worries that they might have coming in. The other focus that we've taken in this pathways model is to develop the resources that are going to help us address that issue of non-adherence, right? We need to build not just a good, here's your program for a few weeks and then off you go, but a system of feedback back to the healthcare provider so that we close these loops so we can help people really develop the habit of regular physical activity. Now, typically in the literature, you saw that diagram, right? 50% of people drop out in the first 6 months. So most of the time, we are looking for 6 months or longer to see people have this change, to be engaging in exercise and reporting the benefits versus dropping out. Now, we know we could have somebody exercising for years and life events can happen and then they can drop out. So it's not a hard and fast rule, but we increase the odds of building this habit and having somebody see themselves as an exerciser. So this is my second take-home message. So the chest opener, full deep lungs, that's the first one. The second one is it's critical that we move people and we help them engage in movement to see themselves as someone who can do this. I can tell you in our programs, I would say 70% plus come in and they don't necessarily think that they're an exerciser. They're there because their healthcare team said you should go do this program. They're there because their neighbor told them about it. They're there because their wife has said, let's go, you're going to this, right? All of those things are happening. And so they don't come in with this view of an exerciser. They might think they can do it. They might not be that bad in terms of confidence, but they don't see themselves. It's not part of their usual routine. It's not part of their identity. And so our goal is to help them build the mental and physical skills so that they can see themselves as an exerciser. And then we know they're much more likely when a barrier comes up. They're tired, they're sick, they're away on a vacation, whatever the barrier is, they can deal with it because they value exercise because it's part of their identity. So with all of that, I'm going to spend the next little bit talking about the resource. So before I get going, my last poll is going to come up here, please. And I'm going to tell you about Excel, which is available to you. This is a Canada-wide program. But before I tell you about it, I'd love you to answer this program. Have you been, and maybe some of you have actually been in Excel, how many of you been in an exercise oncology program? So not just you're doing exercise, but you've been in a tailored exercise oncology program that you were introduced to as part of your cancer journey. And I do know out there in Winnipeg, I've been there before, the REFIT program and the REFIT Center has got some exercise oncology programs. So maybe you've been to that. Awesome. I'm seeing some thumbs up. That's very fun on the screen. Thank you. Okay, so we can see here, despite all this evidence, despite the guidelines, most people have not been offered. And we had a pretty active group. So some of you are doing things on your own. Some of you have just been active and staying active. But many of you, the vast majority, have not been provided with access to, support for, and exercise oncology program. Okay, you can keep voting. I don't know what my participation is like here in the votes. I will just say I teach undergrads. I teach a class of like 300 plus students, and whenever I get them to vote, we're in person, not online, and I get them to vote, and I'm like, so you're the yeses, you're the nos, you're the not quite awake yet, not engaging with me, not going to give me a vote yet. So I know some of that's probably going on. Alrighty, I'm going to shut this poll down. Just highlights, you know, a vast majority of people not getting access yet to these programs, and so Excel. And so I've chosen to share with you tonight just the resources that you can actually access. So we've been doing programming almost since I started here at the University of Calgary. My focus in my lab here and the work that I do is to build sustainable, implementable, community-based programs for individuals living with and beyond cancer. So we've had all sorts of programs over the years. Our big one that Excel has built upon is called ACE, the Alberta Cancer Exercise Program. So that's a provincially delivered program across Alberta that really hit only our urban centers, and it's myself and my colleague, Dr. Margie McNeely at the University of Alberta. So we received funding. We ran ACE very successfully for about 7 years, and now I'm still running ACE in Southern Alberta, and Margie has it in Northern Alberta, mostly from donations and the ability to keep kind of people coming into our programs and giving them this resource. But ACE, hugely successful. We have over 3,000 people in our trial, which is the largest implementation exercise oncology study in the world. And then a few years ago, based on the success of ACE, we were able to apply to the Canadian Cancer Society, Canadian Institutes of Health Research, and we have funding from Alberta Cancer Foundation to build and deliver Excel, Exercise for Cancer to Enhance Living Well. So Excel is taking our Alberta-based model and bringing it across the country. So Excel is for all individuals with a cancer diagnosis who live outside of major urban centers for the most part, or are in locations where there typically haven't been access to exercise oncology programs. So Excel started right as COVID hit, and we were able to pivot and do most of it online, but also to offer even to people in urban settings, if they had in-person programs before that were shut down and weren't online during COVID, the ability to get them into these programs. So Excel's eligibility criteria, as you can see here, are for all individuals up to 3 years post-treatment completion. We will take people after 3 years if they've been referred by their healthcare providers, so they have late or long-term effects. It's for adults only. And this actually says consenting in English, but we have now translated Excel into French. And so our hub out of Quebec runs our French Excel version, so it is now available in that as well. And then people just have to be able to move, to ambulate, low to moderate activity. So you don't have to be regularly active. You don't have to have a certain level of fitness, as long as you can comfortably and safely move. And then because Excel is across Canada, the vast majority of our programming is offered online via Zoom. So you join online, you have an instructor, and you are exercising from your own home. So makes it a lot more accessible, and we'd love to have more and more in-person programs, but when we're focusing on reaching people outside of urban centers, that's typically been why they can't do a program, because the programs are all offered in the major cities, but they might be somewhere off and half an hour away, an hour away, hours away, and not be able to get into programs. So this was purposely designed to address that gap, which continues to exist in exercise oncology and reaching the underserved rural remote populations. So Excel has got a lot of components. It is built as a study. It's a hybrid effectiveness implementation study, same as ACE was, with the goal that we move it to program implementation. So a bunch of safety pieces, and that's like our base level is it's got to be safe before it can be effective. So we have a team of hub sites across Canada. Unfortunately, we don't have a hub in Manitoba, but our hub in Ontario and in Alberta help to serve and cover any participants that might be coming from Saskatchewan and Manitoba. We have clinical exercise physiologists. So that's your top level of fitness professional or registered kinesiologist they can be, that can screen and prescribe exercise programs. We liaise with the healthcare teams to get medical clearance as needed, and we have a great team of cancer physiatrists that we're working on triage and screening pathways with. And then once people are screened, that really determines what class they go into. So with the Excel setup, we've got these hub sites at our major universities. That's through our research collaborators, but then we're training fitness professionals across provinces. So we do have Excel trained fitness professionals from Manitoba who might be leading an online class from there. We actually have fitness professionals in every province and territory that are helping to deliver Excel, and they would then lead the classes online. However, if someone is screened as high risk, so metastatic cancer, currently on treatment, or has significant comorbidities, they're only coming into actually CEP-led classes. So the way Excel is set up is once you're screened, we're able to then offer you the right class for you, and then we work on the logistics of timing and can you make that class, etc. So we've got a lot of offerings that we can give to people to help them fit in, and hopefully it's delivered by somebody in their province so that we can, work easier with time zones and just building that sense of community within your province. The actual program, so first of all, it's free. It's funded by those agencies so that we can give you a free 12-week program. They're all group-based, so you can kind of see the tiny screen in the picture here, but that is an Excel class. So you've got your computer, the instructor's at the other end, and all these boxes are there, but you pin the instructor. So everybody's really just looking at the instructor. We often get asked that, are people going to be watching me? And the short answer is no, and the long answer is no. Everybody's busy doing their own thing and watching the instructor. So you get 2 classes a week, each is an hour, and the classes are multimodal exercise, meaning you're going to get some lung and heart work, aerobic activity. You're going to get a lot of functional strength training. So we focus on functional movements, sit to stands, lunges, squats, but adapting. So if someone can't do those, they would do chair-based exercises. So we have the instructor who's on Zoom, but then we also have a moderator who's there to help with people that need adaptations for safety and the setup and make sure that it's kind of flowing smoothly. We also always have 2 people in case there's ever an emergency and we have to deal with that. So there's a lot of pieces in place to ensure that it can be run very safely and very effectively. Along with the actual exercise program is we build in all of these next pieces that I'm going to share with you around supporting behavior change. So we have a series of webinars. We have pre-post time. So it's really hard to talk during a Zoom class when you're listening to the instructor. So we have pre and post time to help build the sense of community, connect with others, and maybe just, learn and meet people in your group a little bit more. And you can see with this one participant's quote from our program this was an opportunity for them to talk and connect with others, but also to focus on something really positive. The nice thing I think that we've built in a lot of our programs, and my exercise physiologists might disagree with me, but it's actually not about the exercise. It's about building this sense of community around wellness, right? And so, yes, you get all the benefits of exercise. Trust me, we measure fitness, and fitness changes for everybody in this program. We measure everything. I should have mentioned that, baseline and then post, so we can see changes and you get those results. So you can see where have you made improvements and where's there still room for more. But it's about building community and helping people connect around health and wellness as they go through this journey. There's a few more quotes here, and I think a big part of what we also do is from the geeky research side, we do a mixed methods approach. So we collect a bunch of quantitative self-report and fitness measures that we actually do online, but we also collect people's stories about the Excel impact. So you can see the things here, my body is stronger, my mind is happier, I feel like I have hope, right? So we're really building this in individuals and offering them this opportunity to empower themselves and to think about how can living well look like for them when they've had this diagnosis of cancer and things have changed, right? So a lot of great input from our participants, really giving us that, that added reassurance that, yeah, this is an impactful program and is something that we have to see embedded in cancer care. So that is very briefly Excel. That is available to everybody. So if you've heard about it, we're intaking Excel for January start dates. It starts every 12 weeks. But as I said, that's just a piece of the puzzle. It's not the full thing. And it's really about how can you support your physical activity behavior change. And so the framework that we train our instructors in as they're leading these programs, and it's central to actually seeing all of our benefits, is this health coaching approach, where the relationship with our participants is centered, and then the instructor is there and the rest of the group is there to really support that accountability and to give you the opportunity to really grow in how you're making these wellness changes. And so this is a central framework and a huge part of our training that we offer to our fitness professionals. What that then translates to is this idea of helping individuals come in and think about not just exercise, although they've joined an exercise program, but people are usually on this continuum of change. And so thinking about, are you a mover and what do you currently do for movement is often an easier first step than asking people, are you an exerciser? And I know I asked you purposefully at the beginning if you are exercising, right? But for individuals often coming into our programs, we really want to make sure that they're thinking about just their movements and starting to identify as a mover. And then through Excel program, we're giving them the resources so that they can see themselves as an exerciser. So I want to work through a couple of the pieces with you, and this is just for you. You can jot down notes at home. I think we've got 15, 20 minutes left here, but we're going to go through some of the processes that we really target within our programs. And it's important to note, I've told you there's 2 Excel classes a week and there's some time pre-post, and there's these additional webinars to build community and give people more resources. But this model that we use is called Exercise and Educate. So during the class, you're going to be prompted by the instructor to think about your goals or to think about what supports you have or what's lacking, what's making this harder or easier for you, right? So it's this constant education by the nature of the positive motivational environment that we're building in Excel. So if you've ever just done like a drop-in fitness class at any gym, you could hit a great instructor and have a great time. You could hit a mediocre instructor, or, I'm not going to go back to that instructor, right? But typically it's you go in, you're pushing hard, you're working out, and then you leave. Different mentality with our programs where there's this focus on wellness and this focus on building community and this focus on how are you going to get out what you need to from each program. So it's questions like this that we would pose to our participants to have them start to think about what's important to them. Why are they making this change? And oftentimes it's this shift in mindset that people will really get from the Excel program, not just the fitness changes, but this shift in, by prioritizing myself and by prioritizing exercise as part of my wellness, this is what I want to get out of it. And this is what I'm starting to see. When people start to see that change, that's what helps them make the habit stick, right? It's when we don't see change that we stop doing whatever we'd started on. And so within that framework that we build and the positive motivational framework that we deliver Excel in, these are the behavior change strategies that we're helping our participants build, right? So you're here tonight getting education, and that's a huge part of our webinars and the pieces we deliver, but we're also addressing goals, helping people to track and self-monitor their behavior, building strategies to address their barriers and plan for where does movement fit in for them? Where does exercise fit in? So it might be the 2 Excel classes a week, but for some people that's just never going to work. It doesn't work with their schedule, their family, their work, their other demands, other wants and needs. And so they might be doing it on their own. Or they might be doing those classes and then starting to add in more across their week to get more minutes and really start to make this as part of what they want. So I'm going to briefly go into some of these pieces and the resources that we've built. So the number one evidence-based strategy that we can all use throughout different aspects of our life and building more wellness and making changes is goal setting, right? And so there's both outcome goals, thinking about where do you want to go. So if you're, thinking of this like a journey, it's you start here and you're going to end up here. So that's your outcome goal. The process goals is how are you getting there, right? Is it a curvy road? Is it a straight line? Behavior change, never a straight line, but how are you getting there? And so we can use goals and SMART goals in particular to help move people and to help them engage in more exercise. So what we've developed are some considerations and then a couple of worksheets that we use within our programs to help people set both those short-term process and long-term outcome goals. Okay. Couple of key pieces here is goals are best when they're challenging yet realistic. So if you set something that there's no way you're ever going to achieve, it's not very motivating, right? It is really that proverbial carrot hanging out in front of you. Oh, my arm disappears when I do that. But it's the carrot out in front. So you can see it, you're motivated to get there, and eventually you'll get that carrot. It won't keep bobbing off in front of you. Key on this is to focus on the process. So what are you getting out of it each and every time in terms of enjoyment, in terms of feeling refreshed, in terms of feeling energized, engaging with others, whatever it might be, right? That process is going to be something that you can get each and every time, versus if you just focus on the outcomes, it might take a while to get to that one outcome that you're looking for. Okay, so focusing on the process and then continually reevaluating, right? Realistic yet challenging goals. So you have to eventually get to it, be able to celebrate success, and then use that for motivation to keep going. So the two types of goals that we have designed, and these are screenshots of handouts, infographics that we have, are SMART goal setting, which you can see here. We have 2 T's in our SMART goals, which you may have heard of before, but we add that social support element, which is central to all behavior change. And we've got a little bit on it, but it is central to supporting people's change. The other types of goals we do beyond SMART goals, though, which are great for kind of your daily, weekly pieces, is to think bigger picture. And we call these our MOVE goals, which stands for your motivation, your opportunities, what do you value, and what's it going to enhance. Okay, so we've got, and you can, I'm going to give you the website at the end, but we've got a website with all of these resources. They're free. You can download, you can print off, you can use them. But there's a lot of great pieces in here just to get you thinking about deeper. So MOVE goals are really about helping you connect to your internal reason for why would you make this change. At the end of most days, it's easier just to sit down and, watch your Winnipeg Jets. I would say Calgary Flames, but they're not very good. My Canucks aren't doing much better, but you want to watch TV, you've got your favorite show. It's easier sometimes to do that. So why are we going to motivate ourselves? Why are we going to get ourselves going to get some physical activity in? So if you can connect to an internal reason for that, your wellness, your health, your survival, your family, yourself, like what is your reason, that can actually really help you developing this habit of sticking with it, even when you don't maybe feel like it. So I'd love for you right now to jot down for yourself what, big picture MOVE goal. I want you to think about, what does it mean to you to move more or to engage in exercise? Why is that important to you? It's kind of the who cares about it, right? Why? What will you get from moving more, from exercising? What benefits are you looking for, right? Many individuals tell us it's to lose weight, and there's nothing wrong with looking at that as an outcome, okay? But that's an outcome that can be impacted by a lot of factors. So think about as many benefits you can, and you saw the range of evidence. So think about the mental benefits maybe that you might be looking for. Think about the empowerment pieces. Think about your emotional well-being. Okay, those are all things we can see with regular exercise. And then the big one is, well, what does it look like for you if you become successful? Okay, does it have to be hitting those guidelines numbers, or can it just be look like you've gotten something in 10 to 15 minutes every single day, right? 10 minutes of activity, if you do that regularly, that's more beneficial than getting, a bunch once a month. Okay, so whatever works in your lifestyle, what does success in movement look like for you? Think about that, right? And then jot that down. And then you can use that as a marker for, okay, well, then what do I have to do to start planning to get to that success? As you move through this, goals are motivating again when we can reach them, because we can see our progress. I think one of the things we often do, though, is we're constantly looking forward, right? And we're like, well, I'm not there yet. And how come I'm not there? And that can be really frustrating. So what I want you to encourage to do is to reflect and look backwards, right? Wow, look at me now. I didn't think I could do this, and now I'm already here from where I started, right? Oftentimes we so are focused on where we need to get to that we forget how far we've come. So I encourage you to also look back and celebrate that, especially when it feels like you're stuck, right? Or when it's been the same. Where have you come from? Okay, and where you are might be where you need to be. Okay, the next piece, and this is really tied to the goal setting, is tracking things. And that can look different for all of us, right? I've got a Apple Watch on. I can track a lot of things. Can't say I actually look at all those tracking things, but I do like when I see my rings ding me and I've closed a ring, right? But tracking can really, again, help us understand what's working or not with our actual activities. It provides some accountabilities and that opportunity to recognize successes, right? And then we can use that information, whatever you're taking in, to adjust what we're going to do moving forward. Okay, so it's a tool that is absolutely tied to goal setting, and it's a piece that our instructors are constantly bringing up and asking people. Even as something like you're in my class, and I would ask you, tell me how you're feeling right now on a scale of 0 to 10 using an effort scale, right? 0, you're not working at all. 10, you're working as hard as you ever could. You know, when I'm teaching, and I do teach every Mondays, I teach at a local center, one of our exercise oncology programs. You know, tell me, how does it feel right now for you? And that's about tracking so that people can constantly be looking at how's their body feeling and making sure they're getting out of it each and every minute what they need to. Now, you can track whatever's important to you. In physical activity, we often talk about minutes, right? It's related to those guidelines levels. I personally just like to track how many things I'm doing each day or across my week. Again, best of intentions all the time. So I'm a physical activity researcher, but I've got 3 children and I've got a 8-month-old lab puppy. And so oftentimes I intended to go to the gym, but I end up just walking the dog. I try not to beat myself up about it, but I know, what I'm trying to get over the course of a week. And sometimes I've got to be flexible and change. You might also just be tracking, how is it making you feel around energy and fatigue levels? Okay. Energy and fatigue thermometers are a huge part of what we integrate into our program. Every time you exercise, it should feel good. Okay. And it should feel good after. One of the common things that we often see happen is people push too hard too soon and they feel exhausted. And then they go, wow, that exercise didn't make me feel very good. I'm not going to do it again. And we get dropouts, right? So it's not the Jane Fonda era of no pain, no gain, right? It is literally, you should feel good as you're moving and be able to monitor your effort and exertion level. And the next day, you shouldn't have this rebound of huge amounts of fatigue. If so, you're literally pushing your body too hard too soon. Okay, so just keep that in mind, and it can be very simple tracking, it can be technology tracking, it can be pen and paper, whatever works for you. You can also track other lifestyle behaviors as you start to build wellness in, whether it's your nutrition, sleep, which is a huge factor and we know is so tied to the energy levels we have and our exercise ability, psychosocial well-being, other functional things. Okay, so there's lots of pieces that you can track to help you again, be in control as you go through this journey and really think about, what does wellness need to look like for you? The next piece, and this is an important one, I often say this is the elephant in the room, right? We're like, yes, come into Excel. It's a great program. We're going to set everything up for you. Yes, to a certain extent, but there can still be many barriers and obstacles. So oftentimes we find people feel even worse. They're like, well, you've given me this program and it's great. And how come I can't just do it? Right. And so anticipating barriers, working around things, and developing the strategies that you need, and recognizing that sometimes life gets in the way, and giving ourselves grace, right? I don't know if you saw on that list, but one of our webinar pieces is on self-compassion and this idea that we're not going to be perfect, right? We're not going to do everything we intend to do, right? There's this big intention to behavior gap and we fall into it all of the time. So recognizing that setbacks will happen and then having some strategies as best you can to prepare for those or to help address them can be really, really important. Common barriers for all of us. Lack of time is the number one barrier for exercise. Then there's other things, not knowing what to do, not knowing if it's safe for me. I'm in treatment. Can I do that or not? I've had this surgery. I have to wait a certain period of time, right? It doesn't feel good, right? So all of these factors are things that when you're in an exercise oncology program, hopefully the program is designed to be able to help you address those and to get those answers. But these are important things that you might need to find information out on or go to some resources to start to plan for things and to see what's going to be normal for you and what works for you as you move forward. The lack of time one in exercise, though, I will say this is one that comes up all the time. And most of us have the time. So I shared those guidelines at the beginning, right? And the guidelines are get 90 minutes a week of aerobic activity. So you're walking, but it can be any aerobic, cycling, swimming, whatever you're doing that's getting your heart rate up, working your lungs and heart. But you can get that activity. It doesn't have to be all at once. So you can get 10 minutes twice a day and add that up over time. That will give you the benefits. So time is something that we've construed as our barrier, and sometimes it really is a barrier, but for most of us, it's an excuse. We don't prioritize exercise because it's just exercise. right? We don't prioritize it. Our healthcare system doesn't prioritize it. Our cancer care system hasn't yet. And so we have this opportunity to say, well, if we're prioritizing this, then we can do what's necessary to make sure we're fitting it in. And the system can support us in doing that. So it makes our job a lot easier. So to address the elephant in the room, be realistic with yourself. Oftentimes people come in and they are like, yes, I can do it all. And then reality sets in. So be realistic and identify your barriers. Set up your environment for success. So for me, I've got a dog. That's a good visual reminder, but workout gear, your runners at the door, winter clothing ready to go so that it's easy for you to fit it in. Social support is critical to address barriers. Figure out who can support you, how, what you need, and go back to your reasons, that motivation, your move goals. I find, and a lot of evidence shows, scheduling it can help you prioritize it, right? So for me, I've got it in my calendar every single day. Yes, sometimes I ignore it. That's the reality of a busy day. However, it's there and it's blocked off as time that I'm going to prioritize movement for my wellness. And then as you shift, as you see yourself as someone who's going to do this, you've prioritized it, it's become part of your identity, it gets harder to skip it rather than easier. So the last piece I want to highlight, and this is our number one predictor of long-term adherence. It's having social support. And it's not just, doesn't mean that you have one person, right? A support person. It's different than that. This is about having an environment around you that values, provides opportunities for, supports being regularly physically active. So it can come in all sorts of shapes and sizes. So if within Manitoba CancerCare, there's the opportunity presented to you from your healthcare team to go into an exercise oncology program, that's a huge source of support. They're providing that pathway navigation to that as a resource. And so you can then use that as that first step versus having to find it on your own, not knowing if it's the right thing, right? So that's a good example of support that comes from the environment around you, the cancer care system. It's key, absolutely key for the development of this movement habits. And we know that social support, social influence, they're all associated with increased quality of life and positive overall sense of well-being. Within the way we've designed our programs, whether it's our original ACE here or the variations we have tailored to different groups, or it's the Excel program across Canada, we've specifically designed it as a group-based program, not a one-on-one. And that's so that we can provide companionship. We can use the group as motivation and that well-trained instructor to promote your health and wellness. And so you get a lot of that. Again, I've already said it, but it's the community we're building around this program and not the actual just exercise in and of itself. So I encourage you to think about where your support's coming from for living well, for building in more movement or engaging in exercise. I don't know, I don't think you have a wellspring out there, but you do have Refit, right? So is there a community that you can tap into that has that awareness, is connected around the cancer, but has that focus on wellness? That can be really empowering and help you make that pathway along that illness journey with that wellness focus. So as we start to wrap this up, a couple of key pieces. We built this little infographic visual a few years ago to help people as they start to move through the pathway to think of these different pieces. And it's not a linear pathway or even this circle, right? It can be from 1 to 5 to 3 to 4 to 2 and then back to 1 again, right? Because things change over time. But it's recognizing these key components that can really help you start to identify as someone who can move more, and hopefully as someone who sees themselves as an exerciser at whatever level that's at guidelines level, at less than levels, whatever it is that works for your lifestyle and helps you to feel empowered, in control, and living well. Just want to highlight at the end here a couple more resources. So Excel's our big programming that is available to you, but we have a ton of resources. Our big educational one is called our Thriver Manual. So this is available, and I'm happy to make it available. I don't know if I already have actually to Manitoba CancerCare, but it's downloadable on our website, and all of the websites up at the end here. It's a Thrive Health Services website. It's free. It's like a magazine style with a lot of wellness resources around exercise, but around nutrition and sleep, self-compassion, all of these pieces, and the different infographics around goal setting and social support and barriers. So a lot of good resources, and it's kind of all in one with this wellness manual here. We also have a YouTube channel on our University of Calgary website, Thrive for Cancer Survivors. So that's our U of C website. And if you go on to that under resources, there's a YouTube channel link. We have tons and tons of videos on there. We've got 12 weeks, not 8 now, but 12 weeks of our exercise oncology program. So the same kind of program you'd see in Excel, very similar, taped and online. We actually have it in Punjabi as well. So in our EDIA work in the South Asian population, we have 12 weeks of Punjabi available online. Hopefully we'll have our French up there as well soon too. We've got a yoga program on here, but then we've got tons of exercises. So if you're somebody who's like, yeah, I've done this before, I can do it at home, I prefer to do things on my own, tons and tons of exercises from our trained professionals on here showing you different options that you can do to build your own program. Just a caveat with all of these are recorded, so they're not supervised live. And so, make sure you're screened to go forward with activity, that it's safe for you, and that you've got an environment with support around you as needed if you're using these on your own at home. So I think I'm right close to time. A couple of big take-home messages. Really important around exercise is to think about those different behavior change strategies that are important. So the goal setting, the barrier management, the social support, the education. Those are the pieces. Like we can teach anybody how to do a squat or a lunge, but it's developing those other skills so that when there are conflicts in your life, when there are things happening, which happens all the time in our lives, you can still figure out what's going to help you make movement stick. And then as you do that, you grow your confidence and you really start to build that identity as someone who is a mover or can exercise. Use goal setting, right? Use goal setting, whether it's to engage in some breath work and stretching, right? Now's a good time, open up through your chest. Do that on a regular basis. Breath work, didn't go into that tonight, but simply focusing on some different breathing techniques can be very energizing and empowering. But set goals for those things and create your plan based on those goals to track it, monitor it, and realize your success. Most of us aren't going to build a habit of doing anything unless we get something positive from it. I think exercise is a tool where you can build that around being social. You can build that around good music, having fun, doing movement that is enjoyable. So find whatever it is for you that can make movement enjoyable. A walk with a friend, a dance in your kitchen, grabbing your partner for a dance, getting out and enjoying some activities with others, right? Find the enjoyment in it, because most of us aren't going to continue to do something unless there's some level of enjoyment, and celebrate your successes as you go along. We've got lots of support and resources. Again, Excel is available to you, as well are all of those resources that are on our websites. And they're tools that can help you really develop the skills and the habits to keep you on track. Hopefully, something from all of this can be what you pull in, again, whether it's those chest openers, your breath work, setting some goals to help you recognize that you are a mover, and you can, if you aren't already, although I know a lot of you were, you can become an exerciser. So with that, contact information is there. If you heard anything tonight and you want to reach out to me, best way is through my lab email. There'll be somebody who will pass it on to me, or they'll answer if they can with anything you've got questions on at all. And then the 2 websites there. So again, a ton of resources on there for free. Please feel free to check it out. Take what you want. For patients, families listening tonight, there's healthcare providers listening as well. There's great resources and tools on there for your patients. So please feel free to download, take, adapt them for your setting, and use them as you're able to. So with that, again, a huge thank you to the organizing committee for having me speak with you at the start of your conference. I hope you have an enjoyable day tomorrow as you engage in listening to many of the experts that they've lined up. And thank you.
Thank you very much. That was excellent. It's been very informative. You showed us the evidence behind, but you also had some very practical pieces, which are really important and relevant for patients. And even sharing the existence of the Excel program, that is also excellent. So that for our patients that are wondering if they would like to access, that will be important for them. And I see a question on that coming up. So I'll switch to questions because we have quite a few, and I
Okay.
would like you to answer as many as possible tonight. So the first question is, do you consider meditation exercise that can help?
That is a great question. So when we look at it from a research perspective, we do not consider meditation unless it's embodied within a movement practice like yoga or Tai Chi. So if it is a mindfulness-based stress reduction type of program where you are sitting or lying down or even standing to engage in it, but without movement, we wouldn't consider that exercise. I didn't share this tonight and the evidence on it, but I'm a yoga researcher. And so the beautiful thing about yoga is you get all the physical benefits, but you get that mindfulness component as well. So to me, it's actually the ideal exercise when you can bring that mindfulness component into movement.
All right. Then let's go to the next question. What are positive influences to help support exercise commitment continuance?
Positive influence to support continuing exercise. So I think if you can build that social support through the community, so whether it's a person that is your walking partner, or it is somebody at home who's saying, hey, did you get your minutes in? Just checking on you, or a friend that does that, or a class that you join, the group class in person or online, right? Those are all communities that can help you become accountable and build in that commitment to keeping the exercise going. I think the other piece is then sometimes it's starting it and making sure, and that's why the exercise oncology specific programs are so important, so that you're starting a program that's tailored to meet you where you're at. So it's not starting off at 100 when you're at 30, right? And if you can experience that success early on, you build your confidence, you see that you've got the skills to do it, and then it becomes easier to stick with it. It can be really hard for any of us if we join a program or a class and right away we're made to feel like we're not ready for it, right? And so that's our whole goal by having these cancer specific programs, is we do tailor and meet people where they're at.
I remember you saying during your talk, start low and progress slow.
Key mantra in our programs.
Absolutely. Absolutely. Okay, let's go to the next question. Is doing house chores considered a form of exercise? With the cancer fatigue, it's hard to incorporate proper exercise after all of the house chores.
I hear you. Yes. House chores, movement. So I want you to not think of exercise as being you need to go to the gym. I want you to think about, when are you moving in your daily activities? So if you are vacuuming, if you're up and down stairs, if you're standing at the sink doing dishes, that all counts as movement. And for us, exercise is structured physical activity for health benefits. So it is defined differently, but we want all movement to count. So we talk about people just accumulating movement minutes. Right. So I'm working and I'm often at my desk all day. You can't see my setup, but I have a stand-up desk. So I have a wobble chair that I get up and down off a lot, and I just move around a little bit more. The literature shows just doing that, not sitting all day, is more beneficial. Right. So if you are not just sitting at home on the couch and, you become that couch potato and you're not moving at all, but you're moving around, you're up and down stairs to do laundry or cleaning, you're wiping, all of that counts. So if that's where you're at and that helps you keep on moving, absolutely. We had a lady years ago when I started, I was doing education at our cancer center, and a woman came up to me after and said, and she was just starting her breast cancer treatment. She was overweight, obese, and she was not an exerciser. And she said, I know I can't start with a program. I'm going to start by walking around my dining room table every day. And so she literally started with that, and she kept in touch with me. She eventually came into our program. She lost a lot of weight, but she literally started with her table and then started doing more and more because she wasn't comfortable going outside. She knew she didn't have the capacity to do that. To then, within the year, she was in our program, and she's a person who's still in our maintenance programs years later. right? So it's possible to start that low and think about, well, I'm going to count these minutes of movement and then just see each day if I can get a little bit more over the course of weeks and months.
Right. And I think this next question is also related to the answer that you gave, but I'll ask it in case you have anything to add. How do
Mhm.
you continue with your exercise routine once you have to return to work full time?
Mm.
My
Yeah, that's a
employment leaves me completely drained.
yes. Yeah, that's super hard, right? And that's that balance of, you've got certain things you have to do in life, return to work, right? And how do you manage to then fit movement in? And I agree, when you've been busy, you're managing your cancer treatment journey, and then you have to return to work, it can feel overwhelming, and that alone is mentally fatiguing, which can be then physically fatiguing. So I think one of the pieces is to really consider like breaking up that physical activity, whatever it looks like, into just manageable chunks. So can you get 5 to 10 minutes in during a work break or a coffee break if you have those at work? Right? Can you move a little bit at work? Can you bring in my desk? I've got stretchy bands or light weights. Sometimes I'll just grab those. So I'm not changing clothes. I'm not going to the gym, but getting those pieces in. And then it's thinking about, can you prioritize it? I mean, I'm personally not a morning person. So as much as I try to wake up early to get it in before a busy day, it very rarely happens. But will I commit to pulling the mat out while we're watching the hockey game or a TV show at the end of the night and doing just even core work on the ground or some
Mhm.
squats and lunges, right? And so if you start to develop and know the exercises, then maybe you can work them in a little bit easier versus having a structured program that can feel overwhelming to go for an hour when you've had a long day.
Thank you. How
Mhm.
do I access the Excel program? Sounds like a great option as it is virtual.
Absolutely a great option. You can email us, that wellnesslab at ucalgary.ca, and somebody within 24 hours, typically other than the weekends, will get back to you with the information so that you can make an informed decision, be screened, and then if you're available or eligible, you can come into the program.
Great. I just downloaded your manual. What a wonderful resource. Thank you. So this is a comment.
Mhm. You're welcome. Everybody download it.
Another question is, do you need a medical clearance before joining the Excel program?
So our exercise team, the physiologists, screen you. We'd only require a medical clearance if they don't feel that they've got the capacity to make sure they can make it an informed decision to make sure it's safe for you. So that's when
Mhm.
we do the work. We liaise back with your healthcare providers to get that screening clearance done. But typically, we have a form, a PARMEDX or a PARQ Plus, so we can work through these typical screening questions plus our cancer specific ones, and be able to make the call and or go back to your healthcare provider as needed. But yeah, there is a screening process, and that's for your safety as well as ours in delivering an online program.
Great. And then there is a question. I think I can answer it. It says the refit program in Winnipeg will not
Mhm.
accept people who are in treatment. Participants must be post treatment. That's what I was told a year ago. And that is correct. Right now, CancerCare Manitoba has a partnership with the Refit Center with support from the CancerCare Manitoba Foundation. And this is a program that has been established for people that are out of treatment for up to 2 years out of treatment. And it's being tailored with a group of exercises for patients that are in this stage of their journey.
Mhm.
Um, Now, having and it's 10 weeks and it's 2 times a week. Having said that, as I mean, this is a program and a partnership that started years ago. We could start exploring other things, right? It doesn't have to be only for patients that are out of treatment. This will, of course, we will have to take some time to explore the possibility. But I think with the Hope and Healing program and this expansion that's happening, I think we could certainly do that.
It sounds like you have
And
a wonderful opportunity with your Hope and Healing program
yes,
to really build in wellness
absolutely.
resources. It's fantastic.
Absolutely. Yeah, and I mean this this whole concept of cancer prehabilitation and
Mhm.
rehabilitation
Yep.
and all the data. In talking to one of our cancer surgeons, she was sharing that there's very good evidence about how exercising before major surgery can help a lot with recovery times after.
Yep.
So yeah, there's a lot of potential,
Yep.
absolutely.
Absolutely. That's fantastic.
And then what else? Um, can my family view this presentation after the event is over? So what I can say to the participants is that if the speaker has provided permission for us to record, those sessions are going to be made available after the fact. So, and you will be able to see those presentations if you come back to this same AirMeet platform. So it's not that you have to go somewhere else, but it will depend on what we have heard from the speaker. So some of them, yes, and some others, not, unfortunately.
And I'm pretty sure I was a yes on mine. I'm
That's
happy
great
to have
news.
it shared.
All right. There's another question here. I missed how to access the Excel program.
The
Can you repeat
easiest
that?
way is to send us an email at wellnesslab@ucalgary.ca.
Okay. So, oh, one more. Um, can you give me an example of a SMART goal related to wanting to start walking?
Yeah, that's a great one. And that's where most people start, right? Is just, I'm going to move more. I'll start getting some walking minutes in. And so the first thing is to really think about for you what's achievable, realistic, but it's going to be a bit challenging. So if I were to say, well, just start with 5 minutes, you might be like, well, I'm already actually doing 15 minutes a couple times a week, right? So you want to really evaluate where you're currently at, and then what does your typical day look like. And I would encourage, and I do encourage folks in our programs and when we do our educational events, is to think about what can you do on a daily basis. So if you're going to set a SMART goal for daily, that allows you then to continually check on it, right? And have that feedback of you were able to do it or you weren't. So you might start with 5, it might be 10 or 15. It really depends on what your level is right now. So make it something that's maybe, depending, again, if you're just had treatment, there's usually, no extra body weight resistance and just very light walking. But you could set a time for that SMART goal. So 5 minutes each day that I'll get in before noon, and I will track it, or I'll have a walking partner, right? So you're building in the specific, what you're going to actually do. I'm going to walk for 5 minutes in the morning, measurable. You've got those metrics there, so you can measure that. Attainable, 5 minutes. If you're at 0, most of us can put in 5 minutes and maybe not be out of breath. You can keep it very light walking. Realistic, so, and relevant to your lifestyle. And then you've got a time before noon, 5 minutes, and tea together. I've said I'll track it, or I'll have somebody check on me, or I'll have a walking partner, right? So that would be a good example of a SMART goal. Alternatively, you might say something about, well, I want to get in a total number of minutes each week, and then I'll break it down to this amount per day, and I want to think of my intensity. So I'm well past treatment recovery. I've got to start pushing it a little bit more. So you might use, for example, the rating of perceived exertion scale to go, okay, I'm going to work out at a level for me that feels light to moderate. And then I'm going to have at least 2 minutes in my 10-minute walk where I push my walk a little bit faster, like really pump my arms in brisk walking, right? So you can do it as smart that way too, where you've got I'm walking for 10 minutes. Most of it's at my usual pace, but I'm going to time myself and do this interval type of workout for 2 minutes. I'm just going to brisk walk and then recover and see how that feels. And, maybe you write that to get in 3 times a week. So the whole point of SMART is to put as many pieces that you can be check off. Like, I can put this down and say, oh yeah, I did the timing, I did the intensity, I did it 3 times a week, whatever your goals are.
Excellent. Just to let participants know, we have added the email address that you mentioned, wellnesslab@ucalgary.ca, into the chat, so you can grab it from there. And we have a couple more questions. Okay, do you have suggestions for staying active during winter without spending too much money or going to the gym, knowing that it might be too cold for people to want to go
Mhm.
outside.
I hear you. We live in Canada. That's a barrier significantly for many of us. So unless you can embrace it and it's safe for you to go outside, bundle up, all the rest of it, I think there are a ton of resources online. And so depending again on your comfort level, depending on your prior experience, but there are, in the YouTube link that I provided, they're all free, right? So you can go and access whatever you want for no cost. You could build a schedule for yourself and have different videos that you're going to look at. So that can be a great one. If you're comfortable and you've had prior experience, you know you're okay to exercise. So all of those caveats in place. There are other great resources online. One that I use all the time and I find it very accessible, it's got all levels, is yoga with Adriene. So Adriene's kind of one of the biggest kind of YouTube sources for online yoga. Very, very therapeutic focus in a lot of her programs, but you can do a 10-minute class, you can do a 10-minute meditation, breath work, you can do an hour power yoga. So you can really search and find what you want. She literally has thousands of videos, and just a lovely personality and the way she comes at yoga. So I think that's an awesome free resource. There's lots of other free ones. And again, it's knowing your comfort level, what your experience has been, and making sure it's going to be okay for your body. So if you're living with advanced cancer, if you've got osteoarthritis and bad knees, right? You need to make sure that whatever you're doing is going to be okay. But I think those can be great options during the winter. The hardest part, I think, maybe is making sure you stay accountable to it, because it's easy to say I'm going to do it and then, oh, I haven't paid for it, I'm not going out to it. You can just, I'm not going to do it, I'll make popcorn and watch a show instead, right? So building in some accountability, like you can still have that popcorn and show maybe after you've done 20 minutes of a mat routine or some core work or whatever it is that you're going to set up. So build that structure in there to help you stay accountable when it's something more on your own, or invite a friend and do it with them. So you can join online and both watch the same program, or come together at one house and do it together. That can be a great way. Or if you've got family or partners in the house, you can add them into it. I think the more we can tap into social support and do it with other people. So maybe there's a night you don't want to do it, but your family member at home's like, come on, we're going to do it anyways. That can really help you even just get started. The
Hmm.
hardest part with exercise is starting each and every time you do
Starting.
it.
Yeah. Yeah.
Mm-hmm.
And this is a really good question that I think can help clarify others maybe thinking the same thing. It says
Mm-hmm.
a lot of this seems to be geared uh, to surgery oriented prep and recovery.
Mm-hmm.
My diagnosis is not requiring a surgery, it's not operable. Um, is this exercise, are these exercise going to be beneficial for me in the context of surgery not being part of my treatment?
Mm-hmm. Yeah, that's a great comment and question. The short answer is absolutely. So if, as long as we are, again, for somebody that's got a more aggressive cancer, screening and intake is really important to ensure that we're not going to give any exercises that would be contraindicated or not good for their body. So that's the first part. But yeah, you can, there's so many different treatments now, right? It used to be surgery, chemotherapy, radiation, and now there's immunotherapies, there's different personalized plans, there's long-term hormone treatments, there's all
Hmm.
sorts that have changed the landscape. And there can be multiple. It can be a pre-surgery and then some adjuvant treatments and then another surgery, right? So
Hmm.
treatment timelines look very different than they did even 10 years ago. And so movement, exercise, again, with that proper screening and intake, we can absolutely ensure that it is going to be beneficial no matter where you're at in your continuum or what your treatment plan looks like. So we have a lot of people in our ACE program, upwards of 40% are living with more advanced cancers, and metastatic cancers for the most part, right? So we're dealing with a lot of individuals who are on various treatments over the course of their exercise program. The beauty about exercise and when you're in the right program is it can be tailored to meet you where you're at, no matter where that is, right? And so that's an important piece to come to mind. It should never be cookie cutter. As you get going, you
Hmm.
have to make sure you're getting what is okay for your body and then can help you achieve the benefits that you're looking for, whether it's functional or mental and
Hmm.
emotional or fitness changes.
Right. And I want to take this opportunity to let our participants know that CancerCare Manitoba also has a partnership with the Wellness Institute here in Winnipeg. And this is for a program involving restorative yoga. It is 8 weeks and it includes breathing, relaxation, gentle stretching. And this particular program is available for people in treatment and up to 1 year after treatment. So, if you would like to know more about this opportunity, please connect with the Hope and Healing program. And I will ask the team to please put our number or email in the chat so that people can grab it for there for asking more information as they need. I don't see any more questions coming at the moment, so I'm going to take another moment to thank you, Dr. Nicole-Culos Reed. This has been wonderful. We've had lots of questions, emojis, indicating that people are really engaged and sharing how they are feeling about your presentation.